Dr. Jason and Dr. Terry join us now from the Smile Center in Robinson, Illinois. And gentlemen, thanks for being back on Valley Showcase.
Doug, it's always a pleasure to come over and visit. Today, I think we wanted to talk a little bit about some implants.
Yeah, tell us about dental implants.
Well, I actually placed my first implant back in 1984. And if you want to believe it, it's still there.
It's still there.
So implants are no longer experimental. And there's just about anything in the world that you can do in dentistry involves implants. Dr. Jason has done very, very well. A lot of good work with single tooth implants. I'm going to let him tell you a little bit about what's going on with his part of the practice.
Okay.
Yeah, nowadays we can replace teeth anywhere in the mouth with dental implants. And from a single tooth right in the front to multiple teeth in the back, we can do some amazing things to rebuild mouths and smiles and allow people function that maybe they've been missing for a while. So we brought some demonstration things here.
Yeah, tell us.
I want to talk about those for a second. So if somebody's missing a couple teeth, traditionally they would have a partial denture, and that is some metal here. It hooks onto some teeth, and in a traditional sense, that can work pretty well for people, but it's often not real comfortable and is not real aesthetic. So now we can actually replace these missing teeth with some select dental implants and not have this bulk of material that has to come in and out of the mouth.
An implant, tell us, for our viewers that may not be familiar with what they really are they removable like this, or is this something that's permanent?
It's permanent.
Okay.
So a dental implant is like a root replacement.
Okay.
It's a little anchor that goes in, and we attach teeth to that anchor in a couple different ways.
Okay.
So
once it's in, you just treat it like a normal tooth in terms of care and everything else.
Exactly,
Okay.
exactly. And it works well for replacing an entire mouth as well. So historically, if you have a denture that just fits in the mouth and is held in by suction, over time that might not fit so well. And as it becomes more and more loose, we have ways that if you don't want to do a full mouth of dental implants, then we can do a few select dental implants and have the denture snap onto those. So
I think it's amazing. It just secures almost just like you would snap a piece of clothing together.
Exactly.
Yeah.
Exactly. And easy to take care of, easy to maintain, and much better function and then nutrition even.
Yeah, and if folks, I know at home, can't handle this and feel it, but that has a firm grip to it. I mean, that's not loose at all.
Right.
So I could see how someone would really enjoy wearing that product. Now, what's the first step if someone thinks that they're a candidate for an implant? They come in, obviously, and get the workup and the exam from you guys?
Exactly. We take a set of x-rays, we do a quick evaluation in the mouth, and we come up with a plan for that individual.
And how long does it take to get an implant made or to get that whole process? You know, once you said, yeah, you're a good candidate, we can make this work, how long a process before they can actually get the implant put in?
Well, that's a great question with a variety of answers depending on the individual. So it could be anywhere from the perfect scenario of it being the same day to several months.
Okay.
Depending on what
Depending
the
on what their situation is, probably how many teeth we're talking about and all those kind of things.
Exactly.
Okay.
Exactly.
Now, I know you mentioned you've been doing this for a while, and I think it's fascinating if people come over to your facility at the Smile Center in Robinson. Downstairs, you actually have a lab where they're working on making the implants. Is that correct?
That's they don't make the implants, but everything that hooks to them.
Yeah, all the yeah,
sure. Everything
the
that goes
pieces
up
that go
on top.
along with it. Yeah,
That's
so
fact.
you've got a lot of stuff internally there that you've got your hands on. So that's wonderful. People can come to a facility like that and get those things met. So thank you for sharing the information with us. It's very good.
You're more than welcome. Thank you, Doug.
We invite everyone to check out the Smile Center over in Robinson, Illinois.